Hi, Jessica.
Yes.
Hi, my name's Lily. I'll be your nurse practitioner today. Do you go by Jessica, Jess?
Jess is fine.
Jess? Okay, what brings you in today?
I'm here for my annual wellness check.
Okay, so by this point we have already provided all her past medical history, so we'll start with the physical examination. I'll go ahead and provide or do hand hygiene. Wash your hands, gloves. So we will start our physical examination with inspection of the head. So I'm inspecting her head. I'm looking for any lumps, any masses, deformity. We'll go ahead and palpate. So I'll palpate the frontal, temporal, parietal, occipital. There's no dentions or deformity. Okay. Then we'll go ahead and inspect her face. So I'm looking for any swelling, redness. I'll palpate her face. Any tenderness, pain with that?
No.
Okay. So then we'll go ahead and inspect her eyes. So I'm looking at the eye structure. I'm looking at the eyebrows, eyelashes, eyebrows. Okay. And then I will go ahead and assess her visual acuity. So if you can read the last line closing one eye, your left, yep, the last line. Can you read that for me?
PEDFD.
Okay. And then can you cover your other eye?
PEDFD.
Okay. Perfect. And then we'll go ahead and if I can have you close your or cover your right eye, and then I will cover my left eye. Look at my nose. How many fingers am I holding?
2.
Okay. How many fingers am I holding?
2.
Okay. Now we'll do the opposite. And how many fingers am I holding?
2. 3.
Okay. Very good. So then we'll go ahead and inspect your eyes. So I'm looking at the conjunctiva, sclera. They're all clear. So now we'll go ahead and look at her pupils. All right, so if you can just look at my nose, okay? And here I'm assessing accommodation and pupillary response and consensual reflex on their other eyelid, or the other pupil. So again, there's accommodation and pupillary response and consensual reflex on the other eyelid. All right, and then we'll go ahead and I'm just going to test the sensation on your face. So if you can close your eyes and tell me where you feel this.
Upper right.
Okay.
Minus.
Yep.
Lower left. Lower right.
Okay. All right. Very good. So then we'll go ahead and move on to her nose. I'm inspecting the nose. There's no discharge. Her septum is midline. We're going to go ahead and palpate. I'm going to palpate her sinuses. So we have the frontal, maxillary, ethmoid, and then I'm going to go ahead and palpate her nose. Any tenderness when I do that? No? Okay. So now we're going to go ahead and inspect the internal of her nose. I would just bring her head back. All right. There's no discharge, no nodes in there. Everything looks healthy. We're going to go ahead and move to her ears. So I will be doing the whisper test. So Jessica, I'm going to have you cover your left ear, and I'm going to whisper something in your ear. Tell me what you hear.
Finals.
Okay? And then if we can do the other ear.
Weak.
All right, very good. So now we're going to go ahead and inspect her ears. So her ears are appropriate height. They're symmetrical. There's no drainage, discharge, anything coming out of her ears. Now I'm going to go ahead and palpate. Any tenderness when I do that?
No.
All right. And now the other side, any tenderness?
No.
All right. So then we can go ahead and look at inside her ear. So for this, I will stand behind Jessica here. I will pull the pinnae back, and I'm pulling it back and up and back, and I see a white pearly tympanic membrane. And then again, I will pull her pinnae back and up, and I can see a white pearly tympanic membrane. Okay, then we're going to go ahead and do the Weber's test. So I'm going to go ahead and strike this tuning fork. I'm going to place it in the middle of your forehead. Tell me what you feel.
Like vibration in the middle.
Okay, so it's bilateral. Now we're gonna do the Vernon test. So I'll do it behind your ear. So that's the mastoid. Tell me what you feel.
Okay, it stopped. I can't feel it.
Okay, can you hear that?
Yes.
All right, and I will do the other ear. So can you feel that?
Okay, it stopped.
Okay, and can you hear it?
Yes.
Okay, so air conduction is greater than bone conduction. Now I want to go ahead and look in her ear as well. So we're going to do the fundoscopic exam. So I'll go ahead and dim the lights and I will adjust my settings. So here I'm just going to brace her head a little bit and I can see the red reflex. I can see the optic disc and physiological cup. Okay, now the other ear, I can see her red reflex, optic disc, and physiological cup. All right. Then we're continuing with the visual exam. I'm gonna have you follow my pen light. So here we'll do the cardinal fields of gaze. So you can follow my pen. And here I'm also assessing alignment and extraocular movements. And if you can continue to look at the top of the pen, okay, and the traction is well there. All right. Then we'll go ahead and move on to her mouth. So I will be looking at her lips. There's no swelling. Everything looks symmetrical. If you can open your mouth. All right, and here we're looking at her pharynx, her teeth, and if you can stick out your tongue, move it side to side. And can you say ah? So her uvula rises uniformly. Great. And then we will go ahead, here I would assess the gag reflex, but we're not going to do that right now. So then we'll move on to her neck. Okay, I'm inspecting the neck. There's no jugular dissension. The trachea is midline. And then we'll go ahead and have you do range of motion. So if you can move your neck side to side. And then can you look up? And can you touch your chin with your chest? Okay. Now can you track my hand? Yeah. And then track my hand. Track my hand. Track my hand. And then since we're here, we'll go ahead and palpate for her lymph nodes. So if you can, scrunch up your shoulders. And here we're doing the subclavicular lymph nodes. Don't feel anything there. Can you shrug against resistance? Can you pull forward towards me? And then back. All right. We'll go ahead and continue to palpate all the lymph nodes. So we'll start with the occipital lymph nodes, posterior ocular, posterior triangle. Then there's a superficial clavicular, deep cervical, and then we're going up to the anterior auricular, down to the tonsilary lymph nodes, maxillary, and then submental lymph nodes. All right, and then we can go ahead and we'll go ahead do your posterior chest. Okay. All right. So for the posterior chest, we're assessing. There's no deformity. There's no ridges, anything like that. So then we'll go ahead and palpate. So any tenderness when you do this?
No.
Okay. Then we'll go ahead and do the CBA. So let me know if you feel pain. Any pain?
No.
Okay. We'll move on to the chest excursion. So I want you to take a deep breath. Okay. And then we'll go ahead and percuss. So here there's resonance and all field sounds. Okay, then I'm going to go ahead and listen to her lungs. So every time that I move my stethoscope, if you can take a deep breath. Okay. Another breath. Another breath. Good. And then we'll move on to the vocal affirmative. So every time that I move my hand, if you can say the word 99,
99, 99, 99, 99, 99, 99,
sounds good and the lungs are clear. Now we'll have you turn back. We'll do the anterior of the chest. So again, I'm inspecting. There's no hard labor breathing, no diaphoresis. The skin looks intact. So we can go ahead and palpate. Any tenderness?
No.
Okay. Then we can percuss. Okay. Then we can go ahead and listen to her heart and her lungs. Okay. So if I can have you take a deep breath. Okay. Another deep breath. Okay. Deep breath. Deep breath. And then two more times. Deep breath. Deep breath. And then we're going to go ahead and listen to her heart sounds. I will first do it with the diaphragm, and then I will do it backwards with the bell. So here we're listening to the aortic, pulmonic, herbs, tricuspid, and mitral. Then I'll go ahead and flip it. Mitral, and there's a tricuspid, herbs, pulmonary, or pulmonic, and the aortic. Alright. So everything sounds good. There's no murmurs, anything like that. Okay, so from this point, I would go ahead and move on to the breast examination. So for the breast examination, I would provide privacy for the patient, and we would expose one breast at a time. So initially, I would be just inspecting. I am inspecting for symmetry, dimpling, any pita orange, any masses. I would have the patient do a few maneuvers as I'm inspecting. So I would have the patient flex, put her hands on her waist, put her hands behind her neck, and then I would have the patient lie on her side. While she's lying on her side, I would have her place her hands behind her neck, and then I would go ahead and palpate the epitrochlear lymph nodes and the axillary lymph nodes. Do that bilaterally. Then I would go ahead and palpate the breasts. It would be from light palpation to deeper palpation in a circular motion. So I would start off like that, just light palpation, making sure that I get all the mass tissue in a circular motion. Then I would do deeper palpations. So again, deeper, I would ask the patient if she's experiencing any pain, any tenderness. All right, so I would do that for both sides or both of her breasts. If the patient was, or the woman was complaining of any nipple drainage, I would have her express that by squeezing, so just like that. And the woman is not, so we'll go ahead and move on to the rest of the examination. So if I can have you lie down, please. All right. Now, first, I would go ahead and inspect the carotid arteries, and I will go ahead and auscultate before I palpate or percuss. So while I'm doing this, can I have you holding your breath? Okay, holding your breath. All right. Then I'll go ahead and palpate. Okay. While I'm in the anterior chest, I'll go ahead and palpate for any hives or frills. So I'm just going over the aortic. Now, Jessica, or one moment, can I have you lie on your left side, left lateral side? Okay. And then here, I would just be listening to the mitral valve. All right. And then if I can have you go back. And here, I'll also go ahead and palpate the PMI. Okay, so there's some pulsation there. I'll go ahead and then move on to her abdomen. So in the abdomen, I'm first inspecting if it's flat, any roundness, distension, discoloration. Then I'll go ahead and listen to her bowel sounds. So it's active in all four quadrants. While I'm already auscultating, I'll go ahead and listen to her arteries. So first we'll listen to her aortic artery, which is above the umbilicus, her renal artery, which is lateral to her umbilicus. Below the umbilicus is the iliac, and then her femoral arteries are. This would normally be done underneath the woman's clothing. So this is her femoral arteries. While up here, I also would just like to go ahead and feel her inguinal nodes and her femoral pulses. Okay, and it's +2. And then we'll go ahead and percuss and palpate her abdomen. So I'll first start off with percussion. So it's resident. Once I hear a dull sound, that's when I know that I have found the liver. So I'll go ahead and palpate. And here, if I can have you take a deep breath. Okay, so I can feel the border of her liver. And then I'll go to the other side and try to feel her spleen. Now I can't feel her spleen, which is a good sign. That means she does not have splenomegaly. Then we'll go ahead and do light palpation. Any tenderness?
No.
All right. And then we'll do deeper palpation. All right, and I'm not feeling any abnormalities, any masses. So then we'll move on to the lower extremities. Now, in the lower extremities, I'm going to inspect and palpate her hips, her knees, her ankles, and her feet. So we're inspecting. There's no edema, there's no crepitus, no deformity. Everything seems symmetrical. So then we'll go ahead and palpate. All right. And then we'll go ahead and do range of motion on her lower extremities. So Jess, I'm just gonna move your legs first, and then if you can do that on your own after I move it. Okay, so we'll do it this way. You can do that on your own flexion, extension. Now against resistance. Now back down. Okay, the other leg, and then do it on your own. And then if you couldn't resist, yep, and then bring it down. Okay, good. And then we're gonna do your hip. So I'm just gonna turn it that way, and if you can do it that way on your own. Okay, then against my arms, then back the other way. All right, you can do it externally, yep. And then on your own, and then if you could push it out, and then bring it in. Okay, and then I'm gonna go ahead and flex your knee. If you can do that on your own. Okay, now push against my hand, and then push down. Good. And then again the knee. You can do it on your own. Bring it back up. Yep. And then bring it back down. Good. Okay. Then the feet down here, we're going to go ahead and, so if you can do this on your own. Okay. Can you do circular motion with your toes? Okay. Can you invert the feet? Okay. That's against resistance, and then expert the feet. Good. And then if you can push against my arm, okay, the gas pedal, and then against my arms. Good. All right. And then while we're here, we're going to go ahead and check for capillary refill. So I'm getting less than 3 seconds. And then we can also check all of her pulses. So first I'll do the popliteal behind the knees here. Okay, so that's 2+. Then we'll do her pedal, her posterior tibia. All right, and then her pedal pulses. All right, good. So then, since we have finished that, I'll go ahead and wash my hands and apply a new set of gloves. And then if I can have you sit up, Jessica. Okay, so I have changed my gloves, done hand hygiene. And then we'll move on to her upper extremities. So for the upper extremities, I'm going to have you pull your arms this way. You can flex, extend. Okay, against resistance, and then push them back down. Then I'll have you go this way up top, so you can do it on your own. Then push against resistance, back down. Okay, then we'll have you flex your elbow there. Yep, and then against resistance, and then push back down. Good. Now, the wrist, if you can move them up and down, okay, then try to push them up, try to push them down. You can invert and then out, yep, and then against resistance, and then the other way. Okay, now can you spread out your fingers like that and don't let me close them in? Alright, very good. So since we're here, I'll go ahead and check her capillary refill. Okay, so it's less than 3 seconds, and then we'll also check her radial pulse. Alright, very good. So then we will go ahead and do her reflexes. So you can just relax. I'm going to go ahead and do first her bicep. Alright, so there's a flickering there. And then we'll do her tricep. Yep, so her arm moved. And then we'll do this side again. So, okay, so that's the brachial reflex. And then that is the tricep. And then we can also do one there, that her arms are flickering. Okay, then we'll move on to the popliteal reflex. Okay. And her arm, or her leg jumped a little bit. Then we'll move on to the Achilles. So I'm just going to place my hand behind her foot there, and I'll go ahead and check the reflex. And I know it happened because there was a plantar flexion. Okay? All right. Then we're going to go ahead and move on to the sensation. So this is sharp, and this is soft, and this is sharp. I'm going to do it on your upper and lower extremities. Please close your eyes and tell me where you feel it.
Soft right.
Okay.
Sharp left. Soft left. Upper left. Ooh, sharp middle. Soft knee. Right knee, sorry. Sharp left shin. Soft right foot. Sharp left.
Okay, very good. And then we're gonna test also the vibration. So you can open your eyes and just tell me if you feel this.
Okay.
Okay. You can feel sensation and vibration. Also, her upper extremities were 5 out of 5. She has good strength. Then we're going to go ahead and do the cerebral function. So if I can have you alternate your arms. Okay. And then I'm going to have you close your eye, touch your nose, touch my finger, touch your nose, touch your finger, and then close your eyes and touch your nose, touch my finger, and then touch your your nose and touch my finger. Okay, good. And then we'll go ahead and move on to okay. I'm gonna have you stand up, and then if you can, put your feet together, and then you can give me your arms. I'll place them this way. Okay, if you can close your eyes and try to just stand there. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so the Romber's test was good. Then we're going to go ahead and have you turn on your side. And if you can go ahead and touch your toes. Okay, and I'm just assessing her spine here. Okay, you can stand back up. And then if you can move it to the side. Yep, so here I'm just inspecting her spine. Well, looks good. Okay, now if I can have you stand here, and then if you can walk towards me. So I'm assessing her gait, and she's balanced, and then we'll have you turn around, and if you can walk in a straight line. Yep, so foot in front of the other. Good, and her gait is steady. So then if I can have you walk towards me on your toes. Good. And then if I can have you walk back in your heels. Okay, very good. Now if I can have you sit on the chair, we'll do the get up and go test. So if you can sit and then stand, walk towards me, and then pivot, and then walk back towards the chair, sit down and pivot. Okay, and I think that completes our physical assessment.